All right, thank you. Well, hi everyone, this is Kate Myers, and thank you for joining our webinar for the Payer-Provider Partnerships in Palliative Care. We're really excited today to talk with you a bit about palliative care education and training. And to introduce our webinar today, I'm going to hand it over briefly to Kate O'Malley, and then we'll get started.
Great, thanks Kate, and welcome again everyone. You may remember in some of our conversations, especially our most recent meeting, that staff members on the team identified having more awareness about educational resources that are available to increase just general knowledge and awareness among healthcare providers about palliative care. They found would be very helpful. I think this comment was in the context of some of the challenges teams are facing in terms of identifying beneficiaries who may be appropriate for palliative care, or even talking in the healthcare among colleagues and among referral sources in general about palliative care to increase awareness about it as a specialty area and as a focus of primary care would be helpful. So we invited Helen McNeil to come and share some of the work that she's been doing both in California and nationally as the head of the Institute for Palliative Care at CSU to share her experiences with us. So we're happy you signed on, and I'll turn it back over to you, Kate Myers, for some logistics.
Great. Thanks so much, Kate. All right. So getting started, let's see if my slides will advance here. There we go. There's always a slight delay, so bear with me as we advance the slides. But today's session is being recorded, so if there are colleagues who couldn't attend, we'll be sending out a link so that you can download the webinar recording as well as the slides. And we have participants' lines muted right now just to avoid background noise and all that can come with that. So if you have a question or a comment or an observation or something you'd like to share, please go ahead and use the raise my hand function or the Q&A box to ask a question, and we'll have some pause points during the session to address those. So on today's webinar, I'm going to start with just a brief kind of high-level overview of some resources around building skills of primary and specialty palliative care. And today, because the topic is broad, we're not going to go into a lot of depth around approaches to engaging and educating providers, patients, and families about the value of specialty palliative care. We're trying to organize a webinar in July that will be more interactive, where you all as teams can talk about what you're doing to try to communicate what palliative care is and what the value is. But we wanted to focus today more on the angle of what are the ways in which your organizations can educate in primary palliative care skills and specialty palliative care skills across your organization. So I'm going to give a high-level overview first about some resources and some other places you can consult afterwards. And then Helen McNeil, the Executive Director of the CSU Institute for Palliative Care, is going to be going into greater depth about their organization's great resources for training, both at the primary and specialty palliative care levels. And then we'll have some time for question and answer and discussion where you guys can weigh in about how your teams are thinking about specialty and primary palliative care education, what resources you've used that have been helpful, and what challenges you've been encountering. And this can also just help inform our ongoing technical assistance that we work to provide to the teams. So at a high level, as you think about primary and specialty palliative care education, there's kind of a few overarching considerations. One is who you're trying to reach with training, whether that's specialty or primary palliative care providers, if it's specific disciplines, social work case managers, physicians, and so forth, or specific departments. And then, of course, you as the palliative care leaders in your organizations thinking about education would need to think about what information needs to be communicated, what information people need to learn, what competencies need to be emphasized. Because as you'll see when we start going through some of the resources that are out there, there's a lot of different types of information that can be taught, from everything around organizing and implementing services to a lot of very specific clinical knowledge and topics to whole courses around communication skills and talking about goals of cares and patients' values and so forth, as well as courses and information on how to assess the impact of your services and the return on investment, metrics, and more. So there's a real breadth and depth of palliative care education resources that are out there, so it's important to think about what it is you're trying to teach and to whom. And then, of course, there's also a lot of options about how these pieces of information or these competencies can be conveyed to people. There are in-person trainings. There are online trainings that are self-paced, completely kind of offline, or people doing them on their own time without regard to a specific set timeline. There's also online trainings that have some self-paced elements and some periodic faculty or peer engagement opportunities. So it's a little bit of a hybrid model. And of course, there's also still the old-fashioned kind of written information available online, and that has its place in terms of education. And then there's also the consideration when thinking about training as to how training opportunities can be integrated into how your organization overall approaches training versus having sort of standalone efforts around palliative care. And finally, of course, logistically and practically speaking, organizations and palliative care leaders need to think about how much time users have and how much need there is for training, because these courses and resources that we'll describe entail a huge range in time commitment. And so there's kind of something for everyone, but that needs to be considered. And of course, there's differences in cost. Some of the resources that we'll describe are free to any user. Some are kind of membership-based resources. Some have a per-user cost, and some entail, if an institution wants to train a bunch of people at once, they can create institution-level contracts. So that's, again, at a high level, kind of the key considerations that organizations and palliative care leaders can think about around education opportunities. I also just wanted to point out, and you probably doesn't come as news to most of you, but there are national standards around educational competencies and training competencies specifically focused on specialty palliative care teams. And both the National Consensus Project, Clinical Practice Guidelines, and the Joint Commission's Advanced Certification for Palliative Care Program standards do specify standards around education. And so I just provided links here, and again, this will be in the slides. If you wanted to delve into understanding a little bit more about what those standards are and think about how your own organization matches up to those or where some gaps might be, that's something you could do as a follow-up to this webinar. So I wanted to just take a couple more minutes before I turn it over to Helen to highlight some resources that are out there that describe a lot of other educational and training resources. So hopefully you've all seen and maybe delved around California Healthcare Foundation's Community-Based Palliative Care Resource Center. And this is just a screenshot of kind of the beginning of the Resource Center that shows the main categories of information that are contained therein. And if you're on this site, you can click on these links to get to specific areas. There's a lot of great resources on here, so hopefully you'll have a chance to tool around here if you haven't already. But I want to highlight that number 7 focuses on educational resources, both courses and other kinds of information to build the skills of palliative care specialists and generalists. So what I wanted to do today, again, in the interest of time, we're not going to kind of delve into what each of these resources are, but I wanted to highlight where you can find more information. So here's the link to the Resource Center. And to just tell you briefly what the 12 in-person and online organizations and sites are that are featured on the Resource Center, so that, again, after the webinar, if there's any that you aren't aware of and want to learn more about or follow up on, you can find those links. So on the Resource Center under Education, there's descriptions and links to, of course, the CSU Institute for Palliative Care, which Helen's going to talk about. There's information on CAPC, which I know all of you are familiar with, as well as the Palliative Care Leadership Centers, both of which most of the content is restricted now to CAPC members. There's also information on the Stanford Palliative Care Training Portal, which is a free online training portal with some specific clinical topics featured, and includes content, pre-test, post-test type of information. So some of those topics might meet your needs. There's also, not listed on our Resource Center yet, but something we're probably going to need to add, a new resource out of Stanford that was launched this past January, I believe, called Palliative Care Always. It's something you can Google since I don't have the link here, and it will be a link on the Resource Center soon. But Palliative Care Always is, they've framed it as a case-based, massive open online course in primary palliative care skills. So it's something that's free, and it in its first iteration this past spring, was launched as a cohort-based course. So people signed up for a specific time period where they were going through the content along the same pattern of time and had opportunities to interact with faculty along the way. And it's a mixture of case studies and video and opportunities to actually interact with the faculty who created the course. So that's called Palliative Care Always, also out of Stanford. Also highlighted on the Resource Center is the Fast Facts and Concepts, which has been around for a long time, but it's still an awesome searchable online library of evidence-based summaries related to a whole lot of palliative care clinical topics. So it's something to peek back at and see if there might be use for in your organizations. And again, EPIC around general primary palliative care and LMEC focused on nursing training, offer both in-person and online curricula. Vital Talk, created by Tony Back and others around the country, focuses on advanced communication skills courses, again with in-person and online options, so a lot of different ways to approach this. The Resource Center also highlights a few more organizations that I'll mention. One is the Palliative Care Education and Practice 15-day course that's run out of Harvard, an intensive course that focuses on physicians and nurses. And the Palliative Care Network of Wisconsin, or PC Now, offers free curricula and teaching resources around palliative care, a lot of information there. There's also a link on the Resource Center to a course that CHCF was involved in developing around interpreting in palliative care, and it's a free workshop curriculum for those who train medical interpreters specific to palliative care. And finally, there's a link to eDoctoring, which is a free online case-based learning platform developed actually in a collaboration among five of the UC campuses, and it also offers CME. Another resource I wanted to highlight briefly before turning it over to Helen is a resource that CHCF put out called Weaving Palliative Care into Primary Care, a guide for community health centers. Which actually the whole report is a great educational resource that could be used with providers within your organizations as a tool to communicate the value of palliative care and what it is, and to start to understand what primary palliative care looks like. But specifically, there's also an appendix in this resource, Appendix F, which focuses on education and training resources to expand primary palliative care skills. And there's a lot of overlap with the list that I just reviewed from the CBPC Resource Center, but there are some additional resources noted, which I'll just briefly highlight a couple of those. And this is the link to that publication, which if you haven't read, I definitely recommend you all do. So these are just a couple of the additional resources for education and training that are highlighted in Weaving Palliative Care into Primary Care, in addition to the ones that I just reviewed from the CBPC Resource Center. So the first is focusing on AHPM and HPNA. These associations offer, of course, educational courses that are in person as well as online. It also highlights ACP decisions, which some of you may be aware of and some of you may not be. This is an organization started by Angelo Volandes out of Harvard, and he has developed a variety of kinds of video tools to educate both patients and providers around palliative care, and using the visual to describe a lot of these concepts. And then finally, another featured resource there is the National Palliative Care Research Center, which focuses on measurement and evaluation tools. So again, another resource for education for providers. So with that quick overview of a lot of different places that you can look for more information on education and training resources, I wanted to turn it over to Helen to talk more specifically about what the Institute for Palliative Care at CSU is doing around education and training. So I'm going to quickly work on changing the screen to feature Helen's screen. And that's just going to take a second. So let's make sure it's working. All right, Helen, I can see your slides, so I think we're all set.
Great, Kate, thank you. And I'm delighted to have the opportunity to be with the group this afternoon. I have to admit, in hearing all the resources that are available, I'm thinking, wow, there is a whole lot that's come into being, and all good things. And I'm excited to have the opportunity to tell you about some of the things that we are doing at the CSU Institute for Palliative Care. So with that in mind, let me just start where I always like to begin a presentation, and you're going to laugh a little bit. when you see this, because I like to begin with the definition of palliative care. And the reason I do that, and I know everyone here is familiar with it, but I think it's really important because every time I don't do it, someone says to me, why didn't you begin with it? Because we aren't all necessarily all in the same place. What I think is really important is that when I talk today about the courses that we're delivering and that we're making available, we use the definition of palliative care appropriate across the full continuum of illness, addressing whole person needs, and really focus on delivery by an interdisciplinary team. And as I said, I know you're all familiar with this, but at the same time, as I talk to organizations, it's surprising how many times we're actually talking about something just a little different, and we're talking just about end-of-life care, where we're talking about across the continuum. So with that, let me move on to the next slide. And our origin has to do with what are today still the barriers to palliative care success. And I think you all know the great work that you're doing and looking at opportunities in terms of strategies for reimbursement and making sure that palliative care is available in communities across California and across the country. Know about these barriers as well as I do, the barriers of reimbursement, the capacity, the workforce issues, and then the challenge of public awareness, particularly given having just talked about the definition, making sure that the public is aware of that same definition and it knows to ask for it, and also that providers know about it, and that gets to the capacity question. So reimbursement, capacity, and public awareness. We're really focused on the second of those, which is the capacity question. Just having a small part, there we go. And so I break the capacity question down into two pieces. First, the lack of a skilled workforce, and then the second part is the lack of accessible palliative care programs and people who know what palliative care is and how to provide it. So the work of the CSU Institute for Palliative Care really focuses on workforce and capacity development. So everything you see today is really going to focus on those two areas. And so with that, let me just, having a small problem here, sorry. So let me just talk briefly about our mission at the CSU Institute for Palliative Care. We are an initiative of the California State University system. So we're a system-wide initiative, the first and still only of its kind in the country. We have as our mission to increase access to and awareness of palliative care by doing what I call the 3+2. And you're seeing the three there on the screen. Number one, educating current healthcare professionals, and that's what we're going to be focusing on in the time together today. But also educating the future workforce and then helping to build community awareness and advocacy. So those are the three areas of focus. Everything we do really pivots off of those three things. I said that we have the 3+2. The +2 is that we approach our mission by creating a model at Cal State San Marcos, which is our home campus, and then working with other campuses across the CSU to create additional hubs. So think of us as a hub and spokes that are focused on educating the future workforce and building community awareness and advocacy. And today we have 7 partner campuses and are working towards having a total of 10 partner campuses. When I talk, and the other capacity is we're chartered to be self-sustaining. We're come from the educational roots of the CSU system. Thanks to the support by California Healthcare Foundation and Archstone Foundation, 3 years ago we were able to get the work of the Institute launched, and their challenge to us, as it was with the CSU, is to be self-sustaining. So those are the 3+2 things that we focus on. Today, we are educating people across the United States and around the world, and obviously across California. A large number of our graduates and our current students come from California, but we've reached a point where the majority now come from outside of the state of California. So where are we in a quick summary? Today we have actually 28 online palliative care courses. It's changed since this presentation got put together, and I didn't change it, but in fact the two latest courses are all related to advanced care planning, and I'll talk about that in a moment. But we have online courses for professionals, and that number is growing all the time. We chose to go with the online model for our education because we felt that that would put the education at the fingertips of people who need it when they need it, and when they have time for it. And that was why our choice was to go online. Having said that, we also, as you'll see as I go forward, we also do provide face-to-face learning opportunities as well, and the opportunity in working with organizations to provide the online learning that we do either as on a customized basis, but also face-to-face if needed. All of our courses come with continuing education credits for social workers, nurses. Some of our courses that engage physician audiences, we have CMEs. We also provide case management CEs where appropriate. And to date, we've trained over 1,700 physicians, social workers, chaplains, case managers, and health professionals. And that number is growing daily. I should have said something a little earlier, because people often ask me, why did the California State University create an institute for palliative care? And I think it's a great question. And I talk about our 1,700 physicians and nurses, social workers, chaplains, case managers with great pride. But we come from an organization, the California State University system, which in fact not only is the largest university system in the United States, it is also the largest producer of healthcare professionals in the United States. We have 19 schools of social work, 18 schools of nursing, 14 schools of allied health professionals, and we graduate about 15% of the national graduating workforce in the country in healthcare each year. In the state of California, we graduate 70% of the nurses, who graduate 80% of the social workers, and about 80% of the allied health professionals. So we really are a healthcare workforce development engine. So when you think about palliative care and making sure that healthcare professionals, not only today but in the future, know about palliative care, then it makes sense that the CSU would be doing this. So let's get a little more specific about what we do. But to do that, I want to spend just a moment talking about the palliative care workforce. And Kate has alluded to this. We look at the palliative care workforce and we say there's the specialist workforce, which all of you on this call, I think, know will never be big enough to support the demand for palliative care in the future. And then we look at the much larger potential of the primary care workforce. When we looked at this, we said, you know, we have to begin with the specialist workforce. And if we do that, then we will expand out to providing resources for the generalist or primary care workforce. So we started with the specialist workforce, and I'm going to step through this in the disciplines where the CSU has really focused, which is nursing, social work, chaplaincy, and that will be where I'll talk first, and then I'll talk more generally about what we're doing for the primary or generalist workforce. So what do we do for nursing? Well, first and foremost, we introduced an RN certificate in palliative care. This is an 8-week online instructor-led course. We use HPMHPNA certified faculty always. It is asynchronous, which means that it runs for a defined period of time so over the 8 weeks, there's a module each week. We expect the work for that module, which is about 5 to 6 hours of work, to be done within that week. There is interaction expected with the faculty and with other students participating in the course. The course is both case-based and informational. There are resources that people get. But the reality is that people can do their work in their bathrobe at midnight if they want, or whenever is convenient for them within that 1 week period. And that is the essence of what I will refer to as an instructor-led or cohort-based course. So we run these throughout the year. It's about 8 weeks long, and all of our courses that we have in the specialist arena, we have done impact analysis on them to ensure that people are getting the results that they expect. We not only look at the evaluations from the courses, but we also look at, are they taking that back into the workforce, and have an independent evaluator look at that. And we have those impact analyses. So we started with an RN certificate. We also now offer the first and only advanced practice RN certificate in palliative care. Now this is a much longer course. It's 8 months of material delivered over 10 months, and we build in breaks because we know people need breaks. It uses a multifaceted, multidisciplinary faculty, and at the end of it, we provide a preparation for the HPMHPN exam. And I should also mention, go back briefly to the RN certificate, a number of people use this as a CHPN prep. It gives them a great grounding if they're new, but it also gives the experienced palliative care nurse an opportunity to get a refresher, become certified, or be recertified. So all of these, right now we have the Advanced Practice RN certificate and the RN certificate in palliative care. We also offer an in-person, in partnership with an HPNA local chapter, a CHPN preparation course, and we are looking to do an online version soon. So those are the kinds of programs at this point that we have to support the development of the palliative care specialist workforce in nursing. In social work, again, starting with what we have for every social worker, we have critical palliative care skills for social workers. And this is really designed for those who are new to palliative care, for those who are not MSWs, who may be MFTs, BSWs. I often say to people, if you're hiring a new social worker, they've never worked in palliative care, you think that they're going to be great in palliative care, you want to give them a grounding, critical palliative care skills for social workers, even if they are an MSW, is a great place to start. Again, highly interactive, an expert faculty, lots of interactivity. And I should say one of the things we hear from a lot of our graduates is the power of the community that they have created with others in their discipline as they have done our courses. And we have an alumni group so they can keep that alive. We also have our post-MSW certificate in palliative care, and it's been referred to as advanced clinical supervision. And so many of our participants who do that course say, you know, I bring what I'm dealing with, the challenges I'm dealing with every day, I bring those into my coursework, and also bring my coursework into my day-to-day practice. And together, I'm really advancing my own work and my knowledge. And I should say, if you're interested in hearing what some people have to say about these courses, any of these courses, we do have video testimonials on our website that you can look at and listen to and hear what people have to say. So the post-MSW, a deep dive, 8 months with 3 weeks on, 1 week off, and potentially other breaks. We do give people breaks over Christmas and things like that. And then the shorter critical palliative care skills for social workers for those who are new. In the area of chaplaincy, we worked with healthcare chaplaincy and created a palliative care chaplaincy competency framework. And based on that, we built the palliative care chaplaincy specialty certificate course. It's 9 weeks, designed by both palliative care and chaplaincy experts. As with all of our cohort-based instructor-led courses, it is high interactivity, and lots of interaction both with the faculty who are experts, highly experienced palliative care chaplains, and also with the other students as well. You know, and again, I hear from our participants that one of the joys of doing the online versus doing something in a classroom or whatever is that you don't have the problem of the person at the front of the room who is always asking questions and kind of dominating the discussion. Online, everybody gets a chance. Everybody is expected to participate. It is part of the expectations of the course, and everybody's voice has a chance to be heard, and with lots of great discussion, dialogue, and learning happening. And then we also have, in addition to the chaplaincy specialty certificate, an advanced chaplaincy specialty certificate, really focused on those who are working in a palliative care team on a full-time basis and focusing on helping them to function fully within the palliative care team. So we know that some chaplains are only working part-time in palliative care. The Palliative Care Chaplaincy Specialty Certificate is great for that. But if you've got a chaplain who's really working full-time in palliative care, wants to raise the bar on their practice and participation as a full member of the palliative care team, then the Advanced Chaplaincy Specialty Certificate is ideal. The prerequisite for that is that they will have done the Palliative Care Chaplaincy Specialty Certificate or be a board-certified chaplain. So that is what we offer for our chaplain colleagues. Now, that's what we've done for the specialist workforce, but we felt that there needed to be more for the primary palliative care workforce. And the place we needed to begin was with the foundation that went across all disciplines and that would allow everyone in a healthcare system to have a common foundation of knowledge about palliative care. We also knew that it needed to be short. It needed to be able to be worked in around all the myriad other educational demands and life demands that people have. So we created 5 modules, one for providers, one for nurses, one for social workers, one for chaplains, and one that's just generally for health professionals. In other words, anyone working in healthcare. It was designed by an interdisciplinary team of experts who began with a common frame of definition. We talk about what is palliative care, how is it different from hospice, who is appropriate for palliative care. That framework is common across all 5 modules. But then what we've done is put in some discipline and role-appropriate tools that, say, in the nurses course, what every nurse needs to know about palliative care, there's tools for nurses. Similarly, in what every social worker needs to know about palliative care, there's some tools for social workers. Not to make them experts in using these tools, but to give them a couple of tools that they can use in their daily practice. And if they want to build more knowledge, then there's a path to grow from there. And that path to grow is to building more of the specialist kind of knowledge with the basic, in the case of social workers, with the critical palliative care skills for social workers. So the other nice thing about the What Every Needs to Know About Palliative Care is that it's really a great way to have everyone in your organization, from the receptionist and the CNA on up the organization, to have a common knowledge about what is palliative care. And so you can use what every health professional needs to know to cover a lot of people who may not going to be providing palliative care, but need to be able to honestly answer the question, what is it and how do I refer someone to it? That's what we provide with the What Every series. And this is a set of courses, very inexpensive. We work with health systems to provide volume discounts for purchases of large numbers of these, so that everyone in an organization has a common framework for understanding what palliative care is. And I have to tell you, it comes out of my own personal experience that so many times people who know what palliative care is, go to an organization, that says they have palliative care and ask the question about accessing it, and the response they get is either something like paleo what, or we don't have that here, when in fact they do. So behind all of this, we want everyone in an organization to know what palliative care is, and that's the Whatevery series. We are already starting to work on what every provider needs to know about palliative care Part 2, which is much more clinically based, fundamentals of pain and symptom management, things you need to know about basic management of common palliative care conditions by the primary care workforce. And we're working on that, and we're hoping to have that in fall of 2016. So that's coming. I mentioned some other things we have for the primary palliative care workforce. We have partnered with the Coalition for Compassionate Care California to introduce Advanced Care Planning Series, and we announced that on National Healthcare Decisions Day in April. These are all self-paced modules. There's 4 of them. There's one on facilitating conversations. There's one on building engagement in your healthcare system or community. There is one about the fundamentals of advanced care planning. And then there's one on billing. And I'm pleased to let you know, due to popular demand, that the billing course is actually going live tomorrow and will be available. And because we've had such demand for that, and the other courses will be following in the next few weeks. So the Advanced Care Planning Series is available. Again, very inexpensive, modular, and an hour to a couple of hours of time for each of the modules. We also felt that palliative care, part of the primary workforce that needed to understand palliative care, were care managers working in health plans and who are so instrumental in connecting people who have serious or chronic illnesses to palliative care resources. So with the generous support of California Healthcare Foundation, we developed, in conjunction with health plans, the Palliative Care for Care Managers course. This is 20 CEs, or 20 case management credits. It's 20 modules, but all part of one course. And I should say it's not 20, it's 20 hours, it's 12 modules, all part of one course with resources, but specifically designed for healthcare care managers to have them comfortable with supporting people who need to access palliative care. So those are some of the things that we offer for the primary care, palliative care workforce. Now, one of the things I like to say is that capacity means more than just building the workforce. It also means supporting organizations in building programs. And so we created a roadmap to help organizations implement community-based palliative care for health systems, for hospices, for community organizations. Our whole goal was to honor our mission, which is to increase access to palliative care, but in this case, to build access to palliative care in the community. So we created an entire roadmap of tools, resources, and courses, self-paced modules that literally walk individuals and organizations through what they need to know to implement community-based palliative care. We provide an introduction that talks and overviews the series. Then we have a module on palliative care models, how to do a needs assessment in your community, and how important this is in organizing the resources both within your organization and within your community, how to identify partners both in the organization and in the community and engage them with your process. Working with Kathleen Kerr and Brian Castle, we have metrics and measurement for palliative care. What are the things that you should be measuring for your organization? How do you do some data-driven planning and make sure your proposals and presentations are appropriate for your organization, leadership, and the things they're concerned about? How do you plan your implementation? how do you do palliative care billing. And I mentioned Kathleen and Brian. We've had national experts develop all of these. Our billing for palliative care module, which will be available later this month, it was developed by Gina Acevedo and Janet Bull from Four Seasons. We have a module coming on private payer partnerships and working with payers, because so many organizations are saying, well, we know we need to work with payers, and with the work you all are doing, you're understanding the importance of building these partnerships. We're trying to help other organizations understand how to follow in your footsteps and build successful partnerships. Because all of this is based on people, and you're talking about building an organization and activities, engaging people, you're talking about change. And we know how difficult change can be. And change in the instance of doing community-based palliative care for many organizations who are working in the community really is a culture change. So we've included a module on facilitating change and the tools for communicating it about that. And then how to educate your patients and their caregivers to embrace palliative care. All of those 11 elements are modules. They're all self-paced modules. And individuals or organizations can buy one module, or they can buy the entire series. And obviously, if you buy the entire series, it's less expensive than if you buy the individual modules, but we make it available either way. And we also make it available to organizations who are interested in having different people do different modules. That happily do that, talk to us, and that's very much what all of this is about. Now, you've heard me also talk about the tools, and I just wanted to put up this slide, and hopefully you can see it easily. But I meant down the left-hand side are the modules, that we just overviewed. On the right-hand side here are the tools that are provided in each of those modules. So everything from, in the introduction, we provide an overview planning tool. In the modules, in the course on models, how do you look at different models? What are the questions you should be considering? We have metrics and measurement, and we provide access to the wonderful palliative care measure menu that Kathleen and Brian developed. 20 tips for compelling proposals, again, that Kathleen and Brian developed, is part of the data-driven planning proposals and presentations. We have job descriptions, sample policies, tools to help you with outreach, a budget worksheet for billing, and how to plan for successful change, an array of tools. And the reason I highlight this is that we know that building a community-based palliative care program takes time and effort, and we also know it takes access to expertise, and we build that into the self-paced course based on who developed it, but also the tools that we provide you, because we know for all of that, your implementation is going to be your implementation, and it's unique to your organization. You need the tools to figure out what's best for your organization. So those are some of the tools in the community-based palliative care series that are there to help build capacity in the community. I also want to mention another course that we have, and this is a 2-day face-to-face course that we offer. This is based on a course that we offered recently in conjunction with the National Hospice and Palliative Care Organization that is called Leading the Way to Community-Based Palliative Care Success. We did this as a pre-conference for 100 people 2 weeks ago in Washington. It's a 2-day face-to-face course with great faculty. Again, we provide the resources and tools. And the nice thing is that this face-to-face course can also integrate with the online modules that we have. So as people who do the face-to-face course, they have the tools they need, a refresher or help in a particular area, you can turn to the online modules for continuous learning support. So this is another option of a way to work with us. I spend a lot of time talking about our online offerings, but we also do have face-to-face offerings where it's appropriate. and love to talk to people about how we can do that. So that kind of brings to an end my conversations with you about some of the resources we have. If you'd like information about all of these resources, you can go to our website, which is csupalliativecare.org, and contact me or our relationship manager, Brandon McDonald, and you have the emails on the screen. You can reach me at hmcneal@csusm.edu or Brandon at bmcdonald@csusm.edu. And with that, I can open it up for questions.
Great. Thank you so much, Helen. That was a wonderful presentation of a lot of great information. So at this point, we wanted to provide over the next 10 to 12 minutes or so a chance for folks to ask questions of Helen. And you can do that either through the question box or by raising your hand. And it looks like we've got a couple of questions that have come in, so I'll try to go through those one by one. So the first question is the Building Excellence in Community-Based Palliative Care seminar for specialty palliative care providers? Who have been the participants in the past?
It's not for specialists. This is really focused on the organizational aspects of building a community-based palliative care program. So the participants have typically been, we've had nurses, social workers, the occasional chaplain, but a lot of administrators, people who are being tasked by their organization to implement community-based palliative care. One of the things we hear from people who attend the programs is, well, I was told to go set up a palliative care program, and everybody sort of thinks it's just go do it. And my feeling was there was more to it. There is more to it. The Excellence program and our Leading the Way program are all really focused on helping you build the pieces to make sure that you really implement the right palliative care program for your organization, for your community, and you put the foundational building blocks in place that will be successful. I think it's really important to have clinical skills. That's critical. That's absolutely critical to the delivery of palliative care. But to have a palliative care program, you have to have the organizational foundation. I've seen so many organizations start a palliative care program with a physician or a physician and a nurse or a physician and a part of a social worker. And they flounder because they don't have the organizational infrastructure support that they needed to be successful. That's what this course really helps those of you who have been tasked to build a community-based palliative care program. It gives you the tools to make sure you're going to be successful.
Thank you. Okay, another question that came in, do you offer any courses for case managers?
We do, absolutely. I'm very excited about this, and because this was palliative care education tools and resources, I didn't include the latest offering. Thanks to generous support from the California Healthcare Foundation and the SCAN Foundation, 2 weeks ago we announced a whole new, I'm going to call it offering, called Care Excellence. It is focused on case management training. Not palliative care case management, that's palliative care for care managers. But this is to train case managers in how to be case managers and deal with the challenges that we're hearing from health plans of finding case managers. We hear they're having to hire folks right out of nursing school or social work school who don't have a background in case management, or they're hiring people who have experience in delivering care but have never been case managers. So with the involvement of health plans from across California, we created Care Excellence, which has a foundational series to train new case managers, an advanced concept series for experienced case managers working with Medicare, Medi-Cal populations and special populations, that gives them the added specialist levels of expertise needed, and then also a mentor supervisor management, we call it the leadership series, that is a face-to-face series of 4 face-to-face one-day programs. All of the foundational series and the advanced concept series are online, and the management series is face-to-face. And if anyone's interested in more information about Care Excellence, just go to www.careexcellence, all one word, .org, and you'll see it. The courses will start to be available starting the foundational series, and the management and leadership series will start to be available in late May and early June, and then will become available. Modules and courses will be available between now and December, and then the advanced concepts series will be available starting in January through to June of next year. So it will be a comprehensive offering for case managers, particularly focused on health plan case managers dealing with special populations. And the reason we did it is because I believe strongly that the folks who need palliative care are often the very folks who also need really effective care management. And so that's why we introduced this other entire offering focused on care management, case management education.
Thank you, Helen. Another question came in, which I think alludes also to some challenges that some participants are encountering. There's a question, are there any resources to help us recruit palliative care workforce?
Oh, wow. I would love to tell you that there was amazing resources. It is the biggest challenge. You know, what I encourage folks to do is, what we've done historically is we have poached from one another. And that isn't helping any of us. All it's doing is driving up the cost of palliative care specialists or generalists. It's, if you have palliative care education, I can get more money. That doesn't help any of us, really. I believe what we need to do is bring more people in, and then as organizations, invest in educating them in palliative care. I think that's a better answer. So hiring, if you can hire someone who's a skilled advanced practice nurse who's interested in palliative care and then invest in their education, or someone who is a nurse or someone who is a social worker and invest in their education, you're really investing in your own organization, and you're much more likely to get great candidates, and you're going to get them trained not only in the specialist knowledge that they need, but they'll also learn about your organization. So I champion hiring people and educating them. I think that's the best way to build palliative care workforce right now. Beyond that, we will occasionally send out to our alumni groups postings of positions. If people send them to us, we do let our alumni groups know about what's available. I'm always happy to do that, but try not to flood them with them, but happy to do that as another resource.
Thank you. So I don't see any other questions right now, but I'll just give another chance for folks to either ask a question or to give a comment about any resources that you've used, either that were described here today or not, anything else that you'd like to share with the group, or any other kind of comments or observations folks have about your own thinking right now about either specialty or primary palliative care education. Any other comments or questions before we close? You can either raise your hand and then I can unmute your line and you can talk to the group, or you can type in the question box. So just give a moment there. In the meantime, Kate or Kathleen, any other? Oh, we have one comment right here, and I'll come back to Kate and Kathleen. So Ann Zisser from Anthem, I'm going to unmute your line, and then you can ask your question. Ann, you should be live. Go ahead.
Okay, can you hear me?
It's a little fuzzy. Can you get a bit closer to the phone?
I'm actually having it through my computer. Can you hear me?
You're perfect. Yes, now we can, yes.
I just want to comment on the Palliative Care for Care Managers course that Helen and her team have developed. Several of our Anthem case managers have taken the course, and they were ecstatic and have just commented continually over the past year of how useful it was in handling advanced illness patients.
Fantastic. Thank you for the feedback.
Thanks, Ann.
Great.
Yes, thank you.
Thank you, Ann. Any other comments, questions, observations before we close?
Well, this is Kate, and I just want to round up the comments in the conversation just by acknowledging Helen's exemplary leadership in palliative care education in the state and in the nation, and she comes to this with a great deal of knowledge about education, but really I think of even the same or greater value is her passion for palliative care and providing the best care for people with serious illness. So it's always, for us at the foundation, been great to work with her as a partner and see how she supports the evolution of palliative care education, both with the work she does, but also how she supports other colleagues in the field as well. So that's my thanks and acknowledgement to Helen for all her great work.
Oh, thank you, Kate.
Well, let me add my thanks, Helen, for your time and expertise today, and thank everyone for attending. And just to reiterate for anyone who logged on late, we will be distributing both sets of slides from today, mine and Helen's, as well as a link to the webinar recording once we have that available for download. And I'll just remind everyone from the Payer Provider Partnerships teams that our next webinar is scheduled for June 6th from 12 to 1. You've already gotten an email from me with the registration link for that, but if you somehow missed it, let me know and I'll send it out to you again. That is going to be featuring Dana Lustbader, a physician from ProHealth New York, who will be talking about the program they have out there that is really kind of innovative and multimodal in their approach to palliative care. They have home visits and telemedicine and caregiver support efforts and use of volunteers, and we're excited to have a chance to hear about that model and have an opportunity to ask questions of Dr. Lustbader. So that, again, will be June 6th from 12 to 1. And you do need to register in advance to get that personalized login information. So thanks again, everyone, for joining, and we'll talk to you soon. Bye-bye.
Thanks, Kate.
Thank you, Helen. Bye-bye. Glenda, are you still on?